So, this is the story of Emily. She is 18 years old and is therefore in the late part of adolescence. This presentation is by Dana Bednar and Kira Bondo. So, the agenda, we are going to go over developmental milestones, fine and gross motor skills, behavioral changes and social communication, emotional and cognitive development, independent evaluations from parents, the physical exam, immunizations, anticipatory guidance, further assessments needed, and tips for parents. So, what is adolescence? Well, first of all, according to our book, or one of our books, adolescence refers to the psychosocial and emotional transition from childhood to adulthood and is influenced by social, genetic, and environmental aspects. Successful development in adolescence culminates in the achievement of goals that provide the basis for a healthy, productive adult life. So, developmental milestones that they go through. This is now considered the transition from childhood to adulthood milestones. Emily feels a sense of belonging in a valued group with her friends. She's acquired skills and mastered tasks that are important to this group and to her. She's developed a sense of self worth. She has developed at least one reliable relationship with another individual. She has her best friend, and she has many other friends as well. She also demonstrates cognitive potential, and we will go into that later as we speak with her about her schools. When it comes to fine and gross motor skills, she has fully physically developed as she is now an adult. Therefore, she has adult reasoning skills. She is able to do anything a fully functioning adult can do. For behavioral and psychosocial changes, there has been a smooth transition for her as she is going through adolescence to adulthood. She has been reworking her family relationships, and she has gone through some degrees of conflict, such as creating her own style with her clothes and her hair, her chores at home, and what that looks like if she moves out soon, her curfew, as she would like to stay out later because she's gotten older, and her different friend groups as she has navigated who it is that she would like to spend her time with. What it looks like when it comes to planning for the future, such as the college she wants to go to, her career, and her relationships. And finally, the mixed emotions that she goes through during this transition. She feels a mixture of anxiety, excitement, stress, and not fully depression, although this is possible, but she does feel a bit sad about letting go of her teen years. She has developed more intimate contact with peers, such as the best friend and the other group of peers that I've mentioned earlier. She does still sometimes get lonely and feels like she's the only one going through things. Sometimes, for her parents, she appears to be anti adult as she wants to be as independent as possible. She's also set in her personality at this time, and she has been developing her own beliefs. She has a more stable body image and a firmer identity, but she does spend more time in front of her mirror, putting on makeup, fixing her hair, and creating her own style. She goes through mood swings from euphoria to sadness, and this can be normal during this time with all the mixture of emotions as she transitions. She has emotional and physical separation from family. She is considering going to college and has applied to many, and she knows that she won't be able to stay at home. This has increased her worry, but she's also excited to hopefully go on this new journey starting next fall. She's also had an increase in her own autonomy, and intimacy and possible commitment is what's taking over her mind more than anything else. She also has a solid consolidation of her own sexual identity. For cognitive development, she is getting ready for college, as I had mentioned earlier, as her dream is to pursue becoming a nurse. She has gone through formal operational thinking, such as propositional thinking, abstract reasoning, able to reason using verbal manipulation rather than concrete objects. She is fully oriented with sense of perspective idealism, absolutism, and with the ability to think things through independently. She has gone through rapid growth in her prefrontal cortex, which is coordinating executive functions of abstract thinking, reasoning, judgment, self discipline, and ethical behavior. She has developed her personality and she has modified her behavior as time has gone on. Therefore, it is important to ask these specific assessment questions during the physical exam, such as her school attendance, her performance, her education, her peers, and her career goals. This is a good time to do an independent evaluation as she is 18 and she is going to be starting to make her own decisions as she goes to college soon. So, there are many important good general interviewing techniques, such as demonstrating respect for her, establishing parameters of what can be accomplished during this visit, using appropriate body language with her to make her as comfortable as possible, executing active listening and communication techniques, validating that her concerns are important and judgment will still not be made no matter what, and maintaining confidentiality with limits regarding being a mandatory reporter and if she has gone through any physical or sexual abuse. So as she enters into the exam room, she tells us that she is here for a physical exam. She has no complaints at this time. She is alone in the exam room as she has driven herself here. She has no allergies, is not taking any medications. Her immunizations are up to date, and we will go over those specifically later. She has only seasonal allergies, but they're very mild. Does not have any surgical history. Her last dental exam was last year in 2022. Last eye exam also in 2022. And she's never had a pap smear as she denies being sexually active. Her mom is 44, alive and healthy. Her dad is 48, also alive and healthy. She has two brothers and one sister, 16, 12, and 10, respectively, all alive and healthy, and they all live together. She denies drinking, smoking, tobacco use, or sexual activity. She is currently a senior in high school who recently found out that she got accepted to nursing school in this upcoming August. She's very excited and also nervous, as we had talked about earlier. She lives with her two married parents and her three younger siblings. Her mom is also a nurse, and her dad is an engineer. She herself is not currently in a relationship. For vital signs, her heart rate is 65, blood pressure 105/72, respiratory rate of 16, oxygen at 99% room air, temperature 36.7 degrees Celsius, and her pain is a 0 out of 10. Her sexual maturity rating is a 5, which we will also go over in the physical exam. She is 65 inches, or 5 feet 5 inches. She weighs 120 pounds, and her BMI is 20, which is normal. For the review of systems, she denies a recent illness or injury, denies headache, hearing difficulty, sore throat, runny nose, or congestion, denies wheezing, cough, or difficulty breathing, denies chest pain or palpitations, denies abdominal pain, nausea, constipation, or diarrhea, denies breast tenderness or lumps, dysuria. She is currently on her menses. It started this morning. It's regular every 30 days and lasts 5 days. She denies heavy bleeding, denies joint pain or tenderness, denies rash, denies difficulty concentrating or ambulating, and denies depression or anxiety. She is well developed, well nourished. Head is normocephalic and atraumatic. Eyes of perla, scleras white, conjunctiva pink and moist. Tympanic membranes are clear bilaterally. Neck is supple, no lymphadenopathy. She is clear to auscultate bilaterally, anterior and posteriorly. Good aeration. S1 and S2 are present, regular rate and rhythm, no murmurs or extra heart sounds. Vowel sounds are active in all 4 quadrants, no organomegaly. She is a sexual maturity rating, or Tanner stage, 5. This is the last stage in adolescence as she is fully developed and is in an adult size. There are no lumps or lesions on her breast, and because she's currently on her menses, the GU exam was deferred at this time. Musculoskeletal, she has full range of motion, 5 out of 5 strength, and upper and lower extremities bilaterally. Skin is warm and dry, well hydrated, no rashes or lesions, and no scoliosis. Her mood and affect are appropriate. She's calm and pleasant. Thought process clear and logical. Cranial nerves 1 through 12 are intact.